Thank you so much, Ashish, for a wonderful, wonderful talk. It was really, really fascinating. I mean, being a foot and ankle surgeon, I was so pleased you mentioned tibialis posterior and Achilles tendon there. But I'm so pleased that I'm joined by the two eminent shoulder surgeons from England. We got Professor Harvinder Pal Singh from Leicester and Professor Amit Tolat. He's from Medway in Kent. And both of them are upper limb shoulder surgeons. So they are the one who are going to ask you all the questions which are from them and the panel. And if you be kind enough to answer some, we'll be very grateful. Thank you.
Hi,
Hello.
hi.
Hi,
Thanks,
Ashish.
Arvinder,
How are
Amit.
you? How can we
Hi.
forget
Hi.
Argentina, huh?
No, I can't. Buenos Aires. Did you see the logo?
Yes. So, Ashish, as you probably know already, in UK, our problem is that patients come convinced they require an operation. And to unconvince them that they need rehab, it takes an effort. Maybe you have some tips and tricks we could use here to, unconvince them that physio can give them the desired result.
I was worried about this facing two shoulder surgeons at the same time. And well, our problems are completely converse. Our tear patients are just reluctant for surgeries. They want everything done with rehab as such. So I really don't know. But sometimes there's a dilemma. I had a slap tear patient today who didn't have a slap tear. And one MRI reported a slap tear. I said clinically it is not. And he was under a lot of stress. A young boy of 25, no injury. And I said, see, your previous surgeon wants you to do a slap repair. I am suggesting let's do a rehab trial. Suppose we do a rehab trial and in 2 weeks' time, I can give you a 50% progression. Your job's done, you skip surgery. And suppose I'm wrong, and it is possible I am. We've not done any harm. So there's a win-win situation here in doing your rehab. And again, there's good evidence that patients who do rehab and come back for surgery later will do far better post-operatively than patients who don't come in for rehab. So there's a good chance they go on rehab and they miss surgery, and then you're restoring back to normal.
Good. Thank you.
Thank you.
So I think the next question we'll ask Amit.
Yeah, hi. Hi, Ashish.
Hi,
So
Amit.
wonderful.
Good to see you.
Hi. So wonderful to see you. And as usual, a wonderful presentation. And congratulations on your work on the PSRP. So like shoulder surgeons, I mean, we face challenges, as Harvinder mentioned. What I wanted to ask you is basically two parts. One is, what do you think is the impact of diabetes on this condition and its effect on the outcomes? Because we do see a lot of diabetic patients in the UK as well with frozen shoulders,
Yes.
and we have this constant problem of the monitoring and the control of this impacting upon their outcomes, whether it be the initial rehab or the subsequent surgery. And the second one is, how do you keep your patients motivated to continue with the rehab after surgery? Would you think that the pre-op rehab is really a good way of making them enthusiastic about continuing with this, because there's a reward-based system in place in the sense that they do well, they see that, and then they get on and do it better, because remote physiotherapy has become a norm nowadays for many of us here in the pandemic.
Yes.
Sorry to ask you two, but thank you if you can answer them.
Well, there's a third question hidden in there. I will try my best, Amit. So we do get, if you look at literature evidence, there's nothing in favor of diabetes or against diabetes, but we know as a whole that group is a difficult group to treat. But I'm more scared of the hypothyroid patients. Now, if you look at the two sets of these patients, why are they the ones that are the most difficult? Why do they have so much grief after shoulder problems? Number one, I think, is the suprascapular nerve, and that has been neglected. And it's a very difficult nerve to pick up clinically on. Because it's a pure motor nerve, there are no sensory components. I think there's a great disservice from our side that we missed up. Because when the suprascapular nerve goes off, they are going to present as a weak rotator cuff, and we're going to treat it as a tendinosis or a rotator cuff tear. Diabetes neuropathy is known, hypothyroid neuropathy is known. So that's how we work on these patients. I have several diabetics who are not so bad and they do reasonably well. And there are others who are a great challenge that
When
you would want to send them off to your
come to me and I'll
enemy.
include it.
So the whole thing is that you have to ensure that diabetes is reasonably controlled. They will take a longer time to get rehabilitated. Our therapists will put much more effort in getting their supra-infra recruited in terms of stimulating those patients. So I mentioned some adjuncts on PSRP. So we do stimulate the nerve with the galvanic stimulation, just the infraspinatus, and that helps to kick them in. And once they improve, then they sail through. But to get that muscle to improve is very important. Motivation, again, if they get pain relief with the exercises, then they do good. So we try not to give them pain just because once they get an easy option to get rid of their pain, they're going to resort to that. And because we measure their strength quantitatively every time, they are disappointed when they find that the strength has gone down. So some of them are called back again once a month just to supervise and ensure that it's recruiting, because there's a huge amount of compensation in the shoulder when doing the conventional rehab. I hope that covers what you asked.
Thank you. I think they're always a challenge, and we have to continuously monitor them here to make sure that it's all going in the right direction. There is a question.
Yeah, so I think, thank you so much. I think
right.
We got a couple of more questions,
Yes.
Ashish, but what I'm going to do is that we got time for the discussion towards after the end of the session, and I'll touch upon on those. But
Sure.
looking at your program, you know, a lot of people in the UK are traveling to India to the Yogagram or naturopathy. It won't be long before they'll be all coming for the shoulder retreat to Pune. Thank you, wonderful.
Oh my God.
Thank you very much
Thank you
indeed
very
for
much.
the wonderful
Thank
session.
you. Thank you. Thank you.
Thank
Yes.
you.
Thank you.